Exploring the glaucoma experience from the patient's perspective. Seeking ways for patients and doctors to work together towards their common goals. Patience has come to the ophthalmologist for help. She has glaucoma, and she is being treated by Dr. Seymour. Knowing that glaucoma can lead to blindness, she comes to her appointment with a lot of questions and concerns, and she knows that her time with the doctor will be brief. Dr. Seymour has trained and practiced for many years and dedicated his life to helping people like patients. Both seek the same goals: to optimally treat patients' glaucoma, to preserve patients' vision, and to optimize her quality of life. But things are not always so clear at the eye appointment. Patience comes to her appointments with a host of needs, concerns, and questions. She, of course, wants her eyes to be getting the best treatment possible. She wants to understand what is happening to her eyes and to her vision, and why her treatment plan is her best hope. Patience is often frustrated and confused. She's not only frustrated and confused, she's often worried and afraid. She's worried about her disease, and she's worried about her vision. And this includes how she's seeing right now. Meanwhile, Dr. Seymour focuses on patients' eyes, the organ. Is the glaucoma progressing? Is it affecting visual functioning as seen in Snellen or field tests? Is the disease progressing structurally? Dr. Seymour's task is daunting. As testing and imaging procedures become more and more sophisticated, a development doctor and patient both appreciate, there is more and more to evaluate and consider in choosing or adjusting her treatment options. And with these come questions of expense. And all this takes place within the constraints of the time Dr. Seymour has to spend with patients. After examining patients, evaluating tests and images, and adjusting treatment, it may seem that there is little time left over for discussion. And explaining medically complex issues and information in a concise and understandable manner is a huge challenge. It's easy to let it pass, and patience isn't asking much. Why doesn't patient speak up? She came in with a list of questions she's been struggling to remember. She hasn't had enough time to digest new information and formulate new questions. She hasn't understood the results of her just completed tests, and time is running out. She's afraid. She's confused. She's overwhelmed. But communication matters. The more patience knows about her glaucoma and how her treatment plan is designed to control her disease, the more likely she is to adhere to her treatment plan. The more likely she is to come for her scheduled visits. The more she understands her test results, the more likely she is to play her essential part in the treatment plan. And the better able she'll be to deal emotionally with her disease. The better patience understands how her glaucoma might be affecting her day-to-day vision, the more likely she is to communicate important information about her vision. Having this conversation is critical to patients getting proper, professional vision evaluation and potential rehabilitation. When patients is left in the dark about her test results, her prognosis, it is not only frustrating and frightening, it is also a wasted opportunity to work together. Information helps. Awareness helps. Communication helps. Communication helps patients to be an active partner in her treatment and helps her to optimize her ability to function in the world with the vision she has.